The Burke Dental Study Club was started at Fort Ord when Fort Ord, the Army base, was in its heyday. It was started by Colonel Alan D. Burke, who at that time was head of the General Dentistry Residency at Fort Ord, and he was very interested in having a meeting to help interaction between military dental officers and the local civilian dentists. About 10 years ago, I got tired of doing all the administrative work, so the Arthur A. Degoni Dental School operates the Burke now, and we have it every year, as you know, at the Naval Postgraduate School, and it's very well attended and very well thought of.
I joined the school in 1986 following a 21-year career in the U.S. Army Dental Corps. I was first associated with Colonel Burke in July of 1964 upon entry into active duty. I was doing an internship in the U.S. Army, and my duty station was Fort Sam Houston, and Brooke Army Medical Center was the hospital where I spent that first year. And upon arrival, one of the first people that I met was Colonel Burke, who was in charge of the Department of Oral Diagnosis at Brooke Army Medical Center.
The Burke is very special to me because when I first started with the Burke, I was a dental assistant myself. And I was asked to help out with the Burke, and in doing so, helping out, I met a lot of nice people, got to work with a lot of nice people, made a lot of lifetime friends, so I really enjoy it.
My first introduction to the Burke Symposium was when I was a resident in 1983 at Fort Ord Hayes Hospital. I was actually a resident with another fellow board member. I'm now a board member of the Burke, and Dr. Richard Davis. And going to the Burke was kind of compulsory at that time because it was an important continuing education venue for us as residents. The intention of the Burke Symposium was to bond the members of the military dental community. We're talking about not only just a dentist, but also hygienists and assistants with the civilian dental community, dentists, hygienists, and assistants. It was an old home week. Every time you came back, you met members of the Army, members of the Air Force, members of the Navy that you had seen at other meetings, as well as civilians, and you had hygienists and assistants there as well. And it was a nice, warm, intimate, educational experience. It took a little doing, but the Navy eventually said, okay, we'll allow everybody to come onto our campus and partake in the Burke Symposium. We had a very, very successful experience, and we've been here ever since. The memory of Colonel Burke was able to be continued all these years, and about 10 years ago the University of the Pacific found our program worthy to be listed with their continuing education programs, and they have been the prime driver now in making sure that this program is a success.
My involvement with the Burke started with my active duty military right here in Monterey at the Defense Language Institute. At the time, I met a very, very good friend and a colleague, a Dr. Richard Davis, who is also a board member of the Burke. He introduced me to the symposium. I learned about the history and how the Burke got started. So I am so honored to have been able to be invited as a board member all these years. One would ask, why the Burke? I love coming to the Burke personally for the reason that there has been so many diverse speakers anywhere from military, from all branches, to local clinicians and international speakers as well. They bring a diverse talent and great science-based evidence dentistry to the Burke. The incredible integrity, talent from the speakers, the friendliness from all the doctors that come and the staff, the wonderful food, of course, and like I said, the beautiful weather in locale.
I graduated from UCSF in 1974. I've lived on the Monterey Peninsula since '75, and I've attended several of the Burke seminars since that time. The course content has always been excellent. So that's why we keep coming back. I'm sure there's some of the other dentists that have been here for as many years as I have come here because the courses are so great. It's local, food's great, facility's great.